Hello, if I could get everyone's attention for a quick PSA announcement regarding concussion recognition and management. Let's start off with a couple of facts. Did you know that there are more fatalities regarding concussions than any other sport injuries? As well as there are 300,000 plus head injuries a year in the US, and that's underreported. And lastly, not all symptoms are noticeable, so be aware. Now, what is a concussion? A concussion is an impact to the head that results in that injury. Concussions can become fatal if not handled correctly the first time. Having a concussion can lead to bruising, swelling, and burst blood vessels. Most concussions happen when a traumatic injury occurs and the brain slams and hits the skull. Also, most concussions are mild unless we get into the second impact syndrome. At all costs, we should try to avoid second impact syndrome. What is a second impact syndrome, you ask? It is when the patient receives a second concussion as they're still symptomatic with their first concussion. This can lead to brain edema, a rise in intracranial pressure that puts the patient in a semi-comatose state, and it turns the mortality rate to a 50%, with that being the best case scenario. How to treat and handle concussion. First, you should assess the patient and make sure there aren't any life-threatening injuries. Make sure to keep the patient calm and coherent until medical staff arrives. And after the doctor evaluates you, make sure you take it easy and no physical activity to not re-injure your head. Lastly, concussion management. As a patient, or if you're a family member, you should be on the lookout for any symptoms or worsening symptoms like vomiting, vision distortion, dizziness, or the headache getting worse, and lastly, drowsiness. If any of these symptoms occur, you should immediately go to your doctor. And finally, don't partake in any activities until your doctor clears you to do so. Once again, thank you for your attention and have a great rest of your day.